Good evening. The March 27th, 2020 Board of Special Call meeting for the Board of Commissioners will come to order. Clerk, I would like it to be stated in the record that this special call meeting is adhering to the Open Meetings Act while practicing social distancing requirements as a result of the COVID-19. I will request our District Commissioner, Tarenia Carthen, to lead us in our invocation, and I ask that the Board of Commissioners and our audience to remain standing for the pledge to the flag.
If our hearts and minds are clear, Abba, Father, we come before your throne as humbly as we can, Father, asking for your guidance and for your clarity and your wisdom during these times. Father, we ask for you to come into this courthouse and, Lord God, let your spirit be the guiding force that leads us to the decisions that must be made at this time. We ask, Heavenly Father, that you would be on the outside of this courthouse, guiding those, Lord God, who are in troubling times. Lord God, we ask that you calm anxieties. We ask, Lord God, that you give wisdom and clarity to those, Lord God, who are seeking it right now in every way. We ask, Heavenly Father, that you would be with our first responders, Lord God, those who are on the front lines during this time. We ask that you would be with our fire, EMS, 911 responders, our sheriff and police departments, Father God, those nurses and doctors, Lord God, who are doing their best, Lord God, in leading the care for those who are in the midst of them and leading the care for those that they leave at home. We ask, Heavenly Father, that you would be with our governor, our president, our chairman, Lord God, and our mayor during this time in Douglas County. We ask these and all your blessings. In Jesus Christ's name, amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much again, Commissioner Carthen, for leading us in our invocation today. And again, Board of Commissioners, thank you so much for convening for this special call meeting today. I would like to thank you for convening, as I just mentioned, and also as we continue to work around the clock with our federal and state and local officials to mitigate the transmission of risk of COVID-19 in Douglas County and the state of Georgia at large. I would like to start by thanking our first responders at Wellstar and Tanner and the Douglas County Fire Department, paramedics, and emergency medical technicians for your extraordinary efforts of triaging and treating, protecting, and preserving the life of Douglas County citizens during this unprecedented circumstance of the COVID-19. I would be remiss not to mention the tremendous amount of work and support and guidance from our public health department and their officials, Dr. Mark, and also Lisa Crossman. Thank you so much. Cobb and Douglas public health staff, our infectious disease teams, our epidemiologists, our physicians and nurses and respiratory therapists, and all of our frontline medical and healthcare support as we grapple with the symptomatic contraindications of this coronavirus pandemic. Today, Board of Commissioners, we are convening to discuss, deliberate, and vote on a COVID-19 ordinance. This ordinance that we are voting on today is a derivative of the executive order approved by the Cobb-Douglas Board of Health on March 25, 2020, containing recommendations tailored to Douglas County for a shelter in place to help flatten the curve in Douglas County. Each board member, you should have received a copy of the proposed COVID-19 emergency ordinance in advance to allow you to review accordingly. I would just frame the document that you were provided, and certainly I will be leading to an opportunity for Dr. Memark to come up and answer some questions and just highlight the purpose for this ordinance, and we'll move from there, just in case you have questions. The ordinance is framed as the following. The emergency ordinance recognizes the serious public health emergency, which is also recognized by the Douglas County Board of Health and various other agencies of the state and federal government. The emergency ordinance is intended to have a duration through April 10th, unless extended, modified, or repealed by executive action. The emergency ordinance strongly encourages public health best practices, social distancing, and limiting public gatherings. All businesses are allowed to function subject to public health best practices, including social distancing, limitations on gatherings, etc. Tab number A, non-essential businesses can operate during the hours of 6 a.m. until 9 p.m. Non-essential businesses are allowed to restock, handle logistic operations post hours. Tab number C, the public is allowed to travel to all non-essential businesses from 6 a.m. until 9 p.m., subject to public health best practices. Tab number D, essential businesses are exempt from any time requirements, but are encouraged to use best health practices, social distancing, limiting public gatherings, etc. People are allowed to travel from any essential purpose such as healthcare, pharmaceutical, medical supplies, etc. In continuation of the chairman's executive order, gatherings are limited to 10 people using social distancing best practices except for household families. Board of Commissioners, before I call the question, I will ask Dr. Memark, our Cobb Douglas public health physician, to come forth and shed light on a shelter in place and what the meaning and how it could help improve the flattening of the curve here in Douglas County. As we tend to improve the capacity, our intent is to improve capacities in our hospitals, protect the safety of our citizens, while yielding consideration for non-essential and essential businesses to remain viable under certain conditions. Dr. Memark, would you please come forward to the podium and enlighten the Board of Commissioners, please?
Thank you, Chairman and Commissioners, for having us here and for considering this shelter-in-place order that we are recommending to Douglas County. So I've talked to a few of you about this and to whoever will listen to me about the situation. We all know what's happening throughout the nation and locally concerning COVID-19. And so as of, I believe it was yesterday, we became the #1 nation in the world for cases for COVID-19. So we have over 85,000 cases, and it is not showing any signs of slowing at this point. In our local region, so last night in Georgia, we went over 2,000, or just today, we went over 2,000 cases. And currently here in our district, we have 23, that's up from 18 yesterday, 23 cases here in Douglas County with 1 death. And I'm sorry to say we have a few more that are being logged in. It's hard for our team to keep up because there are so many cases that are coming in. So we've talked about this a few times. So this is, we have no vaccines and we have no treatment for COVID-19. So this is a novel virus, and you might have heard of coronavirus previously, but this is something that our bodies have had no immunity to, and this is why it's so critical right now. You have heard that, you know, a majority of people who get COVID-19 will probably have a mild course and not end up being having too severe symptoms, but we have 20% of people who become very, very seriously ill. And so just to give you a little bit of idea, you know, we're about 30% of all the cases that we have in Georgia are hospitalized right now. And we have a considerable number of deaths. We have over 60 deaths in the state of Georgia. So So when we think about what we can do, we only have one weapon here. The only weapon we can do is stop transmission. So when you think of trying to stop transmission of an infectious disease, there are not a lot of choices here, right? So the only thing we can try to do is what we're doing right now. We're 6 feet apart from each other. We're here for an essential and very important function. But this is the only way that we can stop it, is to be able to stay away from each other. So this is why we're talking about this today. I don't see my favorite graphic, but flattening the curve. So what does that mean? I was able to show that last night. When you look at the curve that we see for COVID-19, if we allowed things to continue without having any significant changes in our behavior, you will see a very steep curve that will go up and just hit, like, just very steeply. Some people may think, okay, well, that's okay. Let's all get it at the same time and we'll get it over with, right? You're right. The time course would be shorter that the epidemic or pandemic would last. Here's the problem, though. Hidden in that curve is a dotted line that goes all the way across, and that is our hospital capacity. That line, that steep line that we're looking at, shoots way past the hospital capacity. So that would put us in a situation like Italy, where we have to decide who is going to be able to get the intensive care help, who is going to get the ventilator, because we're not going to have enough. That's period. You look at New York, they don't have enough ventilators, and they're doing novel things like trying to put 2 people on 1 ventilator at this time. That's where they're at, right? So when we talk about flattening the curve, yes, it is painful, social distancing, and it has an impact on our economy, and we recognize that. It is able to give us more time, so we can extend the amount of time that this epidemic will happen, and we will stay under the curve of hospitals. So the hospitals have enough time to take care of the people that become seriously ill. That is why we're doing this and why we're suggesting it. So the only thing we have, we've tried with some measures, but it just really hasn't been enough. I mean, it's to the point where, we're having a hard time keeping up with the cases. You asked me a few weeks ago, I could tell you, okay, this case was related to someone who traveled to Italy. This case was related to someone who had COVID-19 and they had contact. I can't tell you that now. Now, all I can tell you is, I have a case here. Let's see if they're high risk, if they infected a bunch of other people in a hospital, in a school, in a nursing home, and so that we can prevent the deluge of patients that are going into the hospital. That's all we have left now. So we come to you with a plea because we don't have any other weapons left, and we really need to stop transmission. The hospital has already informed us. I got the latest update. They only have 1 ICU bed available at Douglas Hospital. So that's it. So, precariously, and that goes up and down, but I have not, over the last week, have not seen it fluctuate more than 1 bed availability. And they are telling us that they are seeing an increase as well. So that is our situation, and it's not a great one, but we still are able to turn the tide. So I can take any questions, and my deputy, Lisa Crossman's here to help with some.
Okay, thank you, Dr. Memark. Board of Commissioners, do you have any questions for Dr. Memark?
Yes, Commissioner? Oh, sorry.
Commissioner
Maybe
Guider.
I can't go. I'm sorry.
Commissioner
Yes.
Guider?
Dr. Niemark, you said that the United States is now #1 in the world, but do you feel like that's tied to the number of testing that we're doing rather than in other parts of the world?
So that's a great question. So we have been able to ramp up testing, and when you see the news reports, we have been able to do more tests than many other countries have, right? So I don't know what the exact number was, but it was in the hundreds of thousands because it changes so rapidly. So yes, we have been able to do more testing, but when you look at it per population, like per 1,000 in population, we're still doing relatively small numbers when you look at that.
Okay.
So I'll give you, and I left that part out, so thank you. We, in Douglas County, are still having trouble getting testing. Okay, so it has improved, and we expect a steady improvement for testing, but we still have very limited amounts, and so does the hospital. Now, it is getting better. So if next week we increase, and then we say, okay, in the next 3 weeks, we will be at capacity. I can test whoever I need to test. That sounds great, right? But
Numbers are going up.
the numbers would go up, but also I'm not getting results back in a timely manner. I think the fastest I've gotten a result back is in 4 days. Some I've gotten no result back, and I see it on Facebook. So, and some of my epidemiologists have to hunt those people down based on what they're seeing on Facebook. So I can't make any decisions based on 2 weeks to get a result back, especially if it's in a nursing home, or it's in a school, or it's in a hospital, right?
I did see on the TV news this morning that someone has come up with a blood test that you can get the results in just a few minutes.
Yeah.
So hopefully that will
Yes, I
come to
hope.
fruition, you know.
Yeah.
But like in New York, a lot of some of their numbers was caused by not shutting down the subways and places like that, and of course the density of that city. But I heard that they are now utilizing hotels, or they're setting up makeshift hospitals. Do you think Douglas County is at that point now that we should be doing that and getting ahead of the problem?
So this is definitely in the realm of emergency planning. So I would not say at this moment we need to do that, but we definitely need to be thinking about that. And I think the hospital systems, we're in regular contact with them, they are thinking about that. And so the good thing is the Wellstar Hospital is a hospital that's here, and they are 11 interconnected hospitals. So I know that they are thinking of ways to increase capability for different systems. So they are definitely, it's on the radar for sure. That trigger is not at this very moment, but it's definitely, if things don't change and they go in the wrong direction, that is definitely a possibility. I know they're using convention centers up north. There are different, and we don't want to get to that point, right? Because if we're using a convention center as a hospital, we're really in dire straits at that point, right?
Yes. But you said 23 here in Douglas County. I thought I heard prior to the calling of this meeting, 27 here in Douglasville.
Well,
Douglas
it
County.
changes very quickly. So
Pardon?
it changes very quickly.
Okay, I thought I heard.
Yeah, was
the
it one on the
chairman.
web? Okay.
It is 27.
Yeah, it's 20. My morning was 23, and then the afternoon is 27. So, and
Okay.
there's more in the queue.
And
Unfortunately.
can I just ask, the one person that died, were they elderly, or do you know? Do you
yeah.
know the circumstances of their death?
I don't have all the details, but they were an elderly person, and so, but I don't have, and I can't give away all the details on. But
Yeah.
they were not a younger person, but more elderly.
And I'm sure that something's being done about our nursing homes or our assisted living homes
Yes.
and everything.
Yeah, and so that is something that, so the delay in getting testing results and amount of testing that we can do is a significant concern for us. So we are being very proactive. At this point, we're not saying to wait for test results to notify us, and I don't like to usually be on TV or anything like that, but I want people to notify us when they have a suspicion of COVID-19 in a nursing home or long-term care facility, because that helps us to get a little ahead of it. Because if I just got a result back for over a week, 2 weeks ago, that I can't do anything with that.
Well,
right?
hopefully that blood test will come through.
Yeah, that
so.
would be. We can pray for that. That would be awesome.
And with that, I yield back, ma'am.
Thank you so much. Vice Chairman Robinson?
Thank you, Madam Chair. All right, so now we're here to talk about this legislation, right? And so we're highlighting the COVID, which I appreciate. But what is the real need? The citizens out of my district have asked, not could we do this, but should we do this? And I've got to ask a few questions, and then just roll with me. All right, so give me the data regarding the number of cases we've had that's reported. I think we started low. Just, do you remember? I need some data. Can you tell me?
The 27 cases for Douglas
27
County.
for that, 23 yesterday. Just give me.
This morning was 23.
Yeah.
Last night was 18.
Yeah. All right, so it's sloping up.
Yes.
All right, so that's first question. The next question, and again, I need data. And we're saying that we haven't tested enough. We're being asked to make a decision to shelter in place, but I have no data to validate this. I get the map, I get that the surrounding counties are coming in, right? But why doesn't Douglas County have data? Now, I get public health, I get it, I know why you're here, but I've got to make my point. But public health is a state agency. Right? You guys are departmentalized like we are. You are a local agency like we are a subdivision of the state, as commissions, as cities. So you're coming alongside as a peer, say, hey, we need some help. We're capacity. So my question is, and I listened to Madam Guider's point, it was dead on. It says, well, we're not quite there yet. Well, the Board of Commissioners has already got to a point where we identified a new hotel that was willing to put theirs up to say, well, we do have capacity ready to go. Right, check. Right? You're saying we're not ready yet. Well, I'm trying to gauge the real urgency here. Right? Got to ask my questions. No. Right? I'm trying to gauge this because I'm not taking this decision lightly. Right? This is just not some cosmetic. You're asking me to pretty much shelter in place and agree with you to close certain businesses with selections where some people get through and some people don't. These are my citizens. I take it serious. I take it serious. So as I sit here and I'm listening, and so so when we talked earlier, and this is important, so I'm just looking for verification. You don't have to defend it. It's about facts, which is we haven't tested enough people. We don't even know where it is. I have no indication. I have no bearing. You have no reference. You're pointing to comparables around us, but why can't we have the same assurances as the other counties by way of testing? Question, how many tests does Cobb County do, since this is Cobb, Douglas? Just facts. How many tests do they do?
I don't have the exact number on how many tests.
Okay, all right.
Done.
So how many does Douglas do?
I don't have the exact number on
Okay,
that.
all right, so stay with me. So I don't have how many tests we're doing? We have no data.
So I can tell you that, the testing that we have, we represent the district. We don't represent just Cobb, we don't represent just Douglas. We have drive-through testing that's available, and all of the patients or clients will go through the same queue, Douglas or Cobb. We don't look at those. So if a doctor refers a patient, then we take care of that patient. And so the numbers that you see, I mean, if you look at it, it's probably kind of a population split. If you look at it, the percentages probably represent this percentage of the population. When you talk about data, this is very important for us to understand about data. Yes, I don't have the ability to test everybody. But what I can tell you is that we have cases that are popping up that is showing indication of community spread. Okay? We have mapped this out, and we have looked at it, and it is not located. Like if I had an E. coli outbreak or a salmonella outbreak in a restaurant, I can tie that together. There is no tying together of this. This is in the community. If we allow this to continue and you wait for the data while the hospitals are telling us that they are near capacity, then it's going to be too late. Okay, because once you wait for it, then remember, it's a 2-week delay. So once we have whatever measures that we put in, we're going to see the results in 2 weeks, because that's the latency period of infection, right?
I understand. All right, so I got, and I'm sure the public has heard this several times, but you're asking me to make a decision. Stay with me. And I get it's about timing. And I had to, and it's a balancing act.
Yes, sir.
Right? It's both. You guys took an oath as medical, cause no harm. Got it. We took an oath. Like, okay, we're responsible for all of it. Right? So we're like, okay, now how are we going to do this? Right? And so you're asking me, like, I get capacity. But I'm trying to say, okay, but what's needed?
We need
If
you
you
to-
need, is it, because again, I didn't get to speak the other day. I got to get this out. If in fact you need testing, and you said, it sounds like, is it a testing issue? And I didn't say you got to test everybody. It's a representative sample. I do get sampling, right? But I'm looking at what my citizens are telling me, says, well, but Commissioner Robinson, why are we, I mean, and again, I'm looking for, well, if you're fact-based as medical, if you're fact-based, in other words, the data will tell me. I'm looking for the data that supports the decision we're making today. Now, it may be a little bit early. I get it. So it's like a leap of faith, like, okay, now, is it here or not here? Where's my facts? But I'm okay. I get you. You asked me to stand with you, but I got to ask the question, if you're standing on what you believe, I got to stand on what I believe. We got to be shoulder to shoulder on this. So I'm like, okay, I got it. It's capacity. You need hotel space, we'll get it for you, get rooms. So again, you're a state agency, I'm local. How do I fund this? I don't get to print federal money. That means if I take from this, it's gonna go over here. So I'm like, are you asking for more testing here? Because citizens says, well, we don't even know about Douglas. I mean, you're talking about the region, all the concentration is in Cobb, but we get that often, but what about Douglas? I cannot express them, I mean, we're going on like, well, we got you. And so we're asking a question that it's like a group thing. We're just moving through this. I'm like, guys, we ain't got no data. I mean, they're just saying that it's overcapacity. Well, what does that mean? Okay, we got one ICU. Well, what do you need? Okay, we need respirators. Well, right now, we want to know testing. How bad or is it not? I get the scale, but you're still asking me to make a faith without data. All right, got it. There's no data. And I'm not invalidating what you stand for. It's just like, okay, well, guys, we have no data. That Woody would support this. But I don't disagree.
I don't think that's true, though. I don't
But
think you can say we don't
I don't want to
have
argue
data.
this. I'm not debating it. You're missing my point. I'm leading it somewhere, right? Which is, but still, if I slow this down, I have no idea what's happening. I know the data is coming. I get it. Now, here's my issue, and this is my point. Well, Douglas County has been proactive in everything it's done from jump. It closed all its parks day one. It's done all the things proactively. The chair in her executive power did all that. Now, we asked this question with folks like, okay, well, what's different? Why are we doing this that we hadn't already done strategically through that? I mean, we blocked all the places that citizens could go for the most part. That was through the public domain. Right? So the question was asked, well, what more are we doing here that actually helps this? Is this more of a symbolic cry to help the state, like, hey, guys, we need some help? I was asked that. Like, what is this? Because it's like, okay, well, we've done all those things. I mean, so what more does this give you if, in fact, we've already done everything and we're being selective in who gets through and who doesn't? Should we just shut everything down and give you your total 2 weeks and be done, as opposed to this selective, like, okay, we'll pick this group, this group, this group, okay, let that company go through, and it's like, okay, guys, y'all, don't play with this. What's needed? Do you want a curfew, shut it down, and let everybody freeze? A true shelter in place, everybody freeze for 2 weeks to give you the time that you need. I'm with you, I'm not disagreeing, I'm saying, I'm speaking to my group to say, okay, do we really just shut this down and give you the time that you need? I'm not laughing, I'm not looking for jokes. I'm like, guys, if this is as serious as you say you are, dude, I'm willing to go there for you. Shelter in place, don't body move, be done with this, give you time, and then we can't let that last forever, but does that give you what you need? I mean, is that what you want to get? Because we're sort of tiptoeing. I have no data. I'm believing you, it's as serious as you are. It's scaling like this, like, okay, I believe you. Life is priceless. I'm with you, but it's the way you're going about, not you, but the way it's being presented is, it's like, I don't know if we're going to get there. It looks like, and then I have no data to support if it's effective or not. So do you need us to go further, or you think this is sufficient? I'll just leave it at that, yes or no. Is this enough? Is it enough? I'm with you.
Yep.
I'm on your side. Is this enough?
I certainly hope so. You know, and we have been advised that the more stringent that we can be, the better. And so, yes, it does give me a little bit of heartburn to have so many exceptions. It does. But, you know, it's better than nothing. If we can really try our best and we can get our message to everybody to take this seriously and to not go out if you don't absolutely have to for the next few weeks. That's what we're asking.
Okay.
And so,
All right, I got one more. All right, so, and last thing, again, what was pushed on is this testing. Did I hear that each test costs $300, relatively speaking? I know it's free to the public, I think, but what does it cost I mean, what is this?
I think the number we got was 70?
About
$90.
for time and lab processing.
All right, so $100. All right, and how many tests do we do a week, roughly? I mean, what is your sample kit that you get?
We have scaled that up. So we started at less than 30, and we're up to 50, about 50 a day for the district right now. And
50?
it is ticking up as we go along.
Let's pick it up. 50 days. Do you have sufficient money to buy the test kits? I mean,
Yeah.
where's your?
We have federal. We do have money, but we don't have test kits. No one has the test kits, and so.
So you
and then
have money.
supplies for test kits are also low too, to actually test people. That is scarce as well.
All right, so it's not a function of money. So I don't need to go into our coffers here locally and say, right now,
No.
we're willing to match you and give you something. So it's not a function of
If
money.
you know somebody has test kits, I would love to get that
All right,
assistance.
I'm going to stay in my financial lane. Madam Chair, they may need some help, but, all right,
People
so.
know people.
No, but you get my point. Dr. Meemar, you know my approach was, I'm trying to get what you really need.
Yeah.
And I wanted to pierce through all the, as I call avatars.
Yeah.
That's out there messaging. It's like, okay, let's get down to what this really is about.
Yeah.
And so if in fact you're saying I need more, then I need it to be said, because I agree that this is like, okay, this is window dressing.
Yeah.
This is not going to get much done. I've seen the Facebook comments. I've seen it, but and I agree. So do we need to go further? So I'm going to yield for my colleagues that went far enough to just sort of establish where I was at. I didn't, I got it. I yield.
Thank you so much. Yes.
Really, so, Commissioner, I really appreciate you going through that. Whatever we do today, whatever you all decide, I hope people are watching this, because no matter what your local government or the federal government or the state government can do, the only way we can stop this is to not transmit it. And so everything that we as citizens of, Douglas County can do, please just try your best to stay at home as best you can. There's things that we do have to take care of, and people we have to take care of, and we do have to work, but however you can do this without transmitting this virus, which is to try your best to stay away from each other, please, no matter what happens, please, everybody just try your best to do this, because that's all we want, is just to break this cycle so we have time and we can take care of, I don't want to see your parents here or my parents that get into this situation, and I am scared for them too. And so that's all please, no matter what happens, please stay home.
Thank you.
Thank you.
Madam Chair.
Okay, thank you so much, Dr. Meemar. Board of Commissioners, I have a profound respect for quantitative data, and I like numbers too. However, I don't want to dismiss qualitative data, and that is equally important in a situation such as, and I like to lean on that mixed method approach, in my opinion, is a more reliable theoretical process for formulating decisions in a moment and time such as this. I think the only data at this time, because of the latency period, will be morbidity and mortality data. And we can tell you how many the number of deaths we have, but right now we cannot tell you the number of transmissions because of our lack of testing. If you look at the map, and I believe, TJ, you were going to place the map up for the Board of Commissioners. I want them to look at this map of Douglas County and just see how we are wedged in the armpit of Fulton County and Cobb County, and then on our distal end is Carroll County. And of course, their testing numbers are increasing tremendously. Our ability to test is very limited, so that tells me that our insufficient data is almost based on common sense right now, that we have more cases than we can actually see. So we're just trying to utilize two things. We're trying to balance the economics and also the healthcare piece, that component based on the limited capacity that we have at hand. I know we just mentioned hotels, but hotels are not equipped with oxygen, CO2. You need all those things. If you need to put somebody to sleep, you need to have special gases and things that are needed for a hospital. So a hotel it doesn't hold water to a hospital. And certainly as a healthcare worker, 40 years, I have to stand on the principles of things that are needed. And if we did, we would have to rent all types of suction machines, and because you have to suction patients when they're on the ventilator. And they had those machines back in the 70s and 80s when I first started in healthcare. And they no longer exist because everything is in the wall now. It's more vacuumed out of the wall. So I just want to just kind of share that with y'all. And right now, our inventory in healthcare is at a critical low level. And I'm just going to stand in the wings for our nurses and doctors and our healthcare system and just be very candid with Douglas County right now. We are overloaded because of COVID-19, not to mention other acuities in the hospital, such as our normal heart attacks, and from oncology to ophthalmology to cardiac and all those, and neurology, and those procedures that are sometimes they just pop up at night. An aneurysm is unpredictable. You cannot predict an aortic aneurysm. It comes at night. So we got to find beds for those patients in conjunction with our COVID patients. And right now we have maximized everything we have in these hospitals. And I love our businesses, and they know that I'm standing tall for them. And that's why this document is giving some leniency to be able to provide an opportunity for our small businesses to continue to function and thrive in the midst of the most catastrophic virus in modern history. And I'm one of the leaders that's sitting at the table that has to deal with this. So I just ask that if we could just look at both quantitative and qualitative at this point, because qualitative is based on perception. And right now, that's all we have, is a lot of it is just perception, because all of us, any of us we are certainly a candidate for COVID-19, whether we are in an asymptomatic state or a symptomatic state. So I just want to just share some things with my Board of Commissioners from my medical perspective. I just had to put my medical hat, and now I put my political hat back on. But I just wanted to share those things because I've been so up close and personal in that arena. And then with that being said, I believe Commissioner Carthen, you had a comment. You have something for Dr.
Mimar.
Dr. Mimar, would you please come back?
As we get ready to make this decision, one of the things, can you briefly talk to the constituents who will be able to look back at this and say, and just kind of give them some guidelines as to what they could do if they think that they are experiencing symptoms, whether you're asymptomatic or you think you are experiencing symptoms. What are some of the things that you can do right now? And I'll tell you why. I had an older constituent that I spoke with yesterday whose doctor told her, you need to go get tested. I feel that you may be a candidate. And because she had no one at home with her, she couldn't go get tested. Mm-hmm. So she called 911, and they said, well, unless it's an emergency, we can't transport you. Mm-hmm. She didn't want to call Lyft because if she was, she didn't want to pass it on to the Lyft driver. Mm-hmm. So she was kind of stuck in between a rock and a hard place. And so I calmed her down and I told her, if it persists, then, we will find a way for you to get to Marietta to be treated. But right now, if you could just hunker down, pray, take some vitamin C, just, stay on the phone with me. I'll call you tomorrow, and I will continue to check on you, right? But can you talk to those who are experiencing it? And of course, we don't have enough test kits. You may not have a way, but what can you do while you are at home?
So that's a great question, Commissioner. Thank you. So because we have limited test kits in different regions of the country, and Georgia is one that the number is increasing, but we're still not at where we need to be. So we can't test everyone that we'd like to test. Right now, we have to prioritize our higher risk individuals. So if you have symptoms and you are in a high risk category, like you're a healthcare worker or you're a public safety person, first responder, or work in a congregate care area, like a shelter or a nursing home, long-term care facility, we need to try to prioritize those people first because they're kind of our frontline staff, right? If you look around the nation, as hospitals become overburdened, they're losing healthcare staff as well. When we lose that, it's very hard for us to replace. So that's the explanation for why we have the kind of high priority list right now. If you are you're symptomatic and you're at home and your symptoms can be managed, so it is not an emergency at that time, we ask you to call your physician like your constituent did. And if you can get testing, if they can put the testing in for you, then great. If you can't at that time, then we want you to stay at home and to take care of your symptoms. Try not to expose people. You can isolate yourself best you can for 2 weeks, not 2 weeks, it's 7 days or 3 days after your symptoms end. You can just care for it like a normal cold if you're okay, right? Now, if you have severe symptoms, so if you have any chest pain or shortness of breath, or you're turning blue, or have some confusion or anything like that, then you need to call for emergency services. And you can let them know if you had been notified, okay, my doctor told me I might have COVID-19, and I'm having a lot of symptoms, and I think that I'm in trouble. You let them know, then that gives them some time to prepare, make sure that they're putting the appropriate protective equipment on so that they don't get infected as well, and they will get you the care that you need. Now, my hope, and I do believe it's going to happen in a good timeline, that we will get more testing available, and so we will be able to test more and more people. And yes, that'll give us a better picture of surveillance. So we're able to find out what's going on in a broader scope. But right now we're hunkered down in more of an emergency mode right now. And so if you're okay, you have mild symptoms, if you're a high priority first responder or something like healthcare worker, let your physician know and we'll try to get you tested. If you're okay and you're not a high-risk group, just hunker down and take care of your symptoms. If you have to get emergency services, never wait for anybody to tell you anything. Go ahead and let them know that there's a suspicion for COVID-19 and you need help. Does that help?
That does.
Okay, great.
That
Thank you.
does. Thank you. I yield back, ma'am.
All right,
Ma'am,
thank you so much.
ma'am,
Commissioner
could
Guyver?
I ask you one more question, please? I'm sorry, had you called on somebody else?
No,
I can't
no,
see you.
I'm sorry, yes.
You're so far away, you guys can't see each other now.
Commissioner Guyver, go on, and then Commissioner Mitchell is next.
Just one quick question. Where do you test here in Douglas County?
So there are different, sometimes your doctor's offices can get some tests. And so that is not, I'm hearing from different, because the private companies, commercial labs are able to do some testing. The hospitals are able to do some limited testing if you're
Our
admitted.
hospital here in Douglas
Yeah, they can
County,
do some,
Wellstar.
but that's inpatient mostly, right? We have a referral line, and I don't have it on me. We can get you the email address. Your doctors should have the email referral. So if you feel like you feel like you have COVID-19 and you're one of those first responders or something, they can put that in the referral, and then it goes to the Cobb and Douglas Public Health RQ, and then we will call you to schedule you to come and do that. And
So in the instance that Commissioner Carthen was talking about, why wouldn't 911 take her to the hospital to be tested?
well, because the hospital is only going to do their inpatient people that they have a high risk of. So Let
But
me
her
tell- they don't-
doctor, her
they don't
doctor
have-
referred her
Right.
for testing.
Yes, but we have many, many, many people that are being referred, and we just don't have enough
Well, where do they
kits.
go?
They're not getting tested. We don't have enough for everybody. So if you're in the hospital and the hospital needs to know if you have COVID-19, they need to confirm that, they're able to get the testing done. But, you know, we have, Douglas has a good waiting list of people that they're waiting for results, but there are some that have like 60, 80, 100 people that are waiting to get their test results back.
But if somebody is running a fever
Mm-hmm.
and has a dry cough, those are two of the main symptoms,
Yes,
I
ma'am.
think. And they were referred by a doctor, are you saying
We
those
don't-
people cannot get help?
Not, sometimes they can, you know, and we're finding patients can get them done different ways, but there's not enough tests. So every doctor can refer it, and we just don't have enough. So they've had to triage even the tests. So, you know, when you go to the ER, you're being triaged. The state is triaging tests, and CDC is triaging who gets tested, because we just don't have enough tests. I know it's not a great answer, but so you have to take care of
No,
it. So remember,
That's not a good answer.
remember, 80% of people have mild symptoms, anywhere from a runny nose to cough, and you know, but it's like a cold, so you can manage it at home if you have, because if you go to the ER with mild symptoms, so if I go in with a dry cough and a fever, what are they going to do for you? They'll run tests on you, but they'll give you Tylenol if they can for the fever. They'll give you some little something for the cough, and you're sent on your way, right? So we're managed. It's called supportive care. We manage these symptoms. If you had a cold, if it wasn't during this time of COVID-19, would you go to the ER for a regular cold?
No, but usually you don't run a fever with a cold.
oh, you can,
Yeah,
though.
with the
You
flu-
absolutely
Well,
can.
okay,
Yeah.
okay. I'm not a doctor, I'm sorry.
Yeah, that's okay.
But,
Remember, you know, coronavirus.
usually if I just have a cold, I just take like Tylenol.
Yeah.
And that's another point I would like to stress. They say don't take ibuprofen or other Aleve and things like that, but Tylenol is what you need to take
Yeah,
if you
okay.
are running a fever with it, so. But
I
that
know it's-
disturbs me that if somebody is referred by a doctor, evidently they had a fever or had these symptoms, and we don't have a place to take them.
No, that's where we're
So,
at right now.
we need to get on the phone with the governor's office. I think the
He
governor's
knows.
office, are they the ones that funnel the money down to the local hospitals and
Remember, it's
everything?
not the money. It's not the money. The governor is working very
The
hard.
the supply
Yes.
chain,
And they're
yes.
working hard on that.
Well, our country was unprepared
Mm-hmm.
for something like this, and a lot of this equipment that we're talking about comes from a foreign country. So we need to learn from this, definitely.
So just
Yes,
one thing to add from an individual
Thank
standpoint.
you, Lisa. Lisa, if you could just state your name.
Sorry, Lisa Crossman with Cobb and Douglas Public Health.
Thank
So
you.
just in that instance, for example, right, one of the reasons you want to be tested in many cases is that it's going to direct your plan of treatment, right? I want to get a test because then my treatment will be X, Y, and Z. In this case, whether you are tested or not, your treatment is going to be the same, right? As Dr. Memark was talking about, the treatment is supportive care for your symptoms, and then if it gets dramatically severe, it's hospitalization. But for most of us, for 80% of the population that has mild symptoms to this, it would be going home, isolating yourself, almost like I do when I have a bad flu, right? I isolate myself from my family. They slide pancakes under the door, right? And I wear it out, right? I work
You
it out.
let it run its course.
I let it run its course. And so my treatment is not any different if I get tested as a person, if I get tested or not. The purpose of the testing is to try to contain the spread in this case. And so because we already know it has widespread community exposure, then the action for everybody is the social distancing to try to not spread it to you or to my family members, right? If I'm homesick, to try not to spread it and get through it and let it run its course. So that's why I wouldn't want you to be so alarmed from an individual's personal care perspective about whether they were tested or not tested or could be tested or not. Their care is going to be the same. It either runs its course
And
or,
up to a certain point.
well, it might run its course for 80% of the population. For another percent, it's going to get more severe, and that's when, again, regardless of a test, you would still have to activate 911 and activate hospitalization for more significant care.
Okay, and
Dr.
it's
Moore.
important to drink lots of Gatorade, electrolytes, and things like that too, I think.
Well, anytime you're ill,
Fluids.
right, and you're not eating or drinking a lot, you have the risk of getting dehydrated.
Dehydrated.
And so we always want folks to continue to drink fluids and eat as well as they can.
All right, thank
Okay.
you. You're back, I'm sorry.
Thank you, Commissioner Guido. Commissioner Mitchell.
Thank you, Madam Chair. And Dr. Mimar, if you would actually come back to the podium, if you would, please. And this will be the last of it, I hope. I hope.
That's
But
okay.
let me first state, though, that I would hope this board would not solicit or suggest what to take, not take, what works, don't work, and give a false hope of what that really is. I think we need to let the experts do their job,
Yeah,
first thing.
and consult your doctor.
Okay, so, thank you. But here are my questions, though, I guess. I'm assuming, because I'm going to get more about the ordinance here, but I just got a couple of questions before that, because this virus is nothing new. This is a strand that's come along with this virus that we just happen to have no cure for. Am I
Well,
correct?
Yeah, so it's
Okay.
a form of coronavirus, which is a common cold.
Correct.
But this is a new one, a new strain that we don't have any
Right.
immunity to.
That is correct. So I just want people, the public to understand that this is nothing new. It's just that we just happen to miss this particular one, and we're working diligently trying to find that remedy of cure.
A vaccine.
A vaccine, thank you very much. So you got the medical terms, thank you, I appreciate it. And we're trying to be more proactive about what it is that we are doing and all that, and the whole testing. But my first question, though, you talked about the testing. And with that testing, it's kind of harming, it's kind of disheartening to hear that we're way off in the testing. And even with the testing, there's roughly a 3 to 5 day return period on the results. That's really what's putting us behind the curve.
Yes, sir.
Not that you don't not only have the proper amount of testing equipment to test.
Yes.
So that's where I guess the bottleneck of this
Yes.
whole situation that we're encountering, correct?
Yes. The results are not real time.
Right.
So decisions can't be made, and we can't wait 8 days to make a
Right.
decision.
Right. So, but with that, I commend you and your staff and the medical industry of what they're trying to do and trying to get ahead of this. But there's not much we can do outside of trying to look at an ordinance of this caliber, which is highly recommended from the board, correct?
Yes, sir.
To actually hopefully flatten the curve, as we keep stating, to hope that this will hopefully in line slow down the visits, slow down the strain on the hospitals and all that kind of good
And
stuff.
maybe a vaccine will come along.
And hopefully
Yeah.
within this whole time frame, a vaccine. But even with that being stated, there's a time frame even in that.
Yes, sir.
And I don't know, is there some?
There's talk of at least a year that
Right.
we'll see that.
Right. And you also talked about, please explain to me again, there's a 20% severe type of candidates.
Yes.
Who is that 20%? Is it based on the factoring of age? Or, I know this virus has no, it doesn't discriminate.
Yeah, yes.
But is age that 20%, or who is that high risk?
So what is being shown in both in Georgia and nationwide is that the 20% that are risk for having severe symptoms, as well as unfortunately related deaths, are older individuals. And forgive me, I know it's not old, but 60 is the age that they're looking at. So 60 and over, and people with chronic medical conditions. So when you see the governor's executive order, anybody with moderate to severe lung disease, people with cardiac problems, diabetes, if you're immunosuppressed or compromised or undergoing chemotherapy for cancer, those people are very high risk. In other countries, like in China, you'll see that there's a more of a male predominance. I think we're showing some of that here, and that the thought is that maybe because of smoking, because males had a higher rate of smoking than women do, that might be playing into it. But we are definitely seeing that. But I don't want people that are under 60 to feel safe either, because we are seeing an increase in people under the age of 60 as well that and are being hospitalized too. So don't feel you're immortal to this.
Right. But when it comes to testing, though, when we
Yeah.
do finally get the proper testing kits and all
Yes,
that
sir.
we need to test, and I'm only speaking of Douglas County. I know there's a dire need in New York and everywhere else. First of all, how will we disseminate that information to those that need it to get to it? And I don't know, is there a time frame that you can anticipate what that looks like?
We take everything is day by day in this pandemic and changes very rapidly. So when the new recommendations come out for testing, we try to get that out as quick as we can. The best place to go to is a CDC website or coronavirus.gov. It changes so rapidly. Sometimes you have to make sure you check it before you even say anything to make sure you have the right information. So as testing availability increases, I expect that the pool of people that will be recommended for testing will also increase. And so what we'll do many times is make sure we tell physicians and public health officials that now we can open up testing. I will say, every now and then we get lucky and we have a little bit more testing that's available, and we will take a look at people that are outside of the high risk for us, because
Right.
not high risk, but the recommended. So we'll look at some older people that have some risk factors and try to get them in as well. It's not that often, but we
Right.
try to get in. We try to use all of our test kits and get as many people tested as possible.
Okay, well, thank you. And again, this is a unique situation that our country is facing and must deal with it as best possible, to include looking at these types of ordinance to hopefully flatten the curve and hopefully get us out of this situation by doing these types of actions that we should take place. But I'm done with you, but I do have a couple other questions, Mark. I don't know if this would be more of to Ken about the ordinance. I want to kind of dive into the ordinance to talk more about from a perspective, and I don't know, Ken Ken is on the line,
Yeah,
correct?
he's-
Okay,
yeah.
okay, so.
We have him on the line.
So with that, I guess my first question is, we're speaking, have we clearly identified essential and non-essential, so the general public can understand who that is, what that looks like, and then I will got a follow-up question when we talk about that.
No, you're fine.
Okay. Commissioner and board members and public, essentially what you have before you is order outlined by the chairman, allows for business activity to continue for all businesses between 6 a.m. and 9 p.m., subject to the public health safety rules, which include social distancing and caps on people in the same space, etc., and also using common sense and best practices. As to essential businesses like first responder, they're not subject to any kind of cap. Also, the public is allowed to travel to any business between 6 and 9 p.m., 6 a.m.
Ken,
and 9 p.m.
Ken, hold on one second.
He's good. I was saying put the phone up to the speaker so the general public can hear as well.
Okay, I
Yeah.
got to do.
Oh, you good? Okay, go right ahead. Go right ahead, Ken. Okay. Go right ahead, Ken.
Am I good?
Go ahead.
Can
Go
y'all
ahead.
hear me?
Okay.
So what this ordinance does is it allows businesses to continue to operate subject to using best practices and safety considerations for not only their guests but their employees. It allows non-essential businesses to continue to function during certain hours. It allows essential businesses like first responders, etc., to function anytime, however, subject to the public safety rules. And it allows the public to travel between 6 a.m. and 9 p.m. for any reason We encourage them not to, obviously, but when they can go to a business, if need be, subject to the safety rules and distancing and all the things that we've talked about and common sense. And it allows people to travel at any time for an essential function like receiving medical care, like going to a pharmacist, like going to a doctor's office or an emergency room as needed. So what we wanted to make clear is this, and this is what we have worked, by the way, with the city. The city's adoption of this was commiserate with my working with Susan Littlefield on the draft. We wanted to make it clear that businesses could continue to operate, but it's really not necessarily business as usual. They need to take the guidance of these healthcare professionals for the safety of themselves, their workforce, as well as the public into account. But also this measure takes into account what we believe to be is going through the Senate, that's been passed by the Senate, and likely in some form or not to be passed by the House and signed into law. And that is, we don't want to take over businesses. Under the Constitution, there is some rules about compensation for taking over businesses, so we don't want to run out of businesses. Now, I'm talking about the law versus the medical community. And our talking about the law is whether or not government can assume a business without paying for it. We want to encourage businesses to try to stay as functional using best practices as they can. We believe with the SBA, the current version that's come out in the Senate bill, if you have employees 500 or less, and you maintain some level of operations and you keep your people employed, that you will be able to get an SBA loan that after a period of time, if the same number of people employed several months after this COVID situation goes away, if it goes away, or if it gets mitigated, if you keep the same level of employment post-COVID that you had before, there is a chance that loan will turn into a grant. In other words, the SBA is being given authority by the Senate to cancel that, because what they're trying to do is keep people employed. So the document you have in front of you is us telling the public, be safe, use common sense, don't go out, don't commingle, listen to the doctors, but at the same time realizing that there is an economy out there that somehow is trying to be preserved while we battle this epidemic across the way. So I hope I've answered your question, Commissioner. If I hadn't, I'll be glad. Essentially, people are worried, do I need to shut down? This thing says, no, you don't have to shut down. If you're non-essential, you can work from 6 a.m. to 9 p.m., but you got to use common sense. You can't have more than 10 people in any area. You should have less than that, obviously. You should be 6 foot apart. Yeah, you should wear masks, gloves. You probably need to be careful when you're in close proximity to somebody and think about, am I creating not only a risk factor for the public and my customer, but am I also creating liability for myself? I mean, if I'm walking around sick and I'm getting within 6 foot of somebody and I get them sick and there's a way to track that, you may have some responsibility aside from whatever government can do. As to essential businesses, they can function. And more importantly for the public can go as needed for essential functions. We would encourage them to try to mitigate that. We would encourage them, if you're of the age that is really successful, which I understand is 60 or over, try to have somebody help you get your groceries. Try not to stockpile, try not to hoard. The supply is there. It's just got to catch up with itself. But you don't need to be out if you can avoid it. So this is a balancing act of taking really the Cobb-Douglas Board of Health's order, which is really in the form of a recommendation. There's some issues about whether Title 31 applies to the sanctions that are in the Board of Health's order, and I've encouraged them to revisit that. But this is us implementing something that helps enforce what the Cobb-Douglas Board of Health is trying to get out. So I hope that answers the question, Commissioner.
Yes, that was good, Ken. I just wanted that to be on record for the public, but I do have one, and thanks for explaining the SBA bill that's in Congress. I don't know if that bill is passed or kind of where it is in Congress and that deals with the SBA, but good to note that it at least it's there and a possibility for our small businesses. However, share with the general public, what's the difference between this particular ordinance versus the one that the city has? What's that difference in the two, which they shouldn't mirror, from my understanding, they mirror each other, but there's a slight difference, correct?
Right. Well, theirs and ours makes it clear about businesses being able to operate and the public having access to those businesses during certain hours. The main difference between ours and the city, besides the whereas clauses, the whereas clauses for the city are different because their mayor and their city council have executed simultaneous or similar orders that have been executed by the chairman, but their reference points are different because it's two different governments. Also, within the city's document, there is no penalty feature. And the reason why there's no penalty feature in the city's document is by their charter and by their code of ordinances, any ordinance that's violated is subject to a penalty. In our case, we don't have an automatic penalty. We put a penalty in there. Ours actually is less than the city's. The city's automatic penalty is up to 12 months incarceration, $1,000 fine. Ours is only up to 6 months and $1,000 fine. But listen, the reason for the penalty is not to go out and start making random, widespread arrests for no reason. I've talked to the sheriff. The sheriff wants people to use common sense, best practices, and I expect fully that the sheriff is not going to block the borders, but when they see behavior that exposes the public to a danger, they're going to try to tell people, please stop it. Give them a warning, do whatever. They're still working on the 7 deadly sins as opposed to just trying to be a Gestapo, so to speak. But they're going to try to give people warnings if need be. Please monitor your behavior. Here's why. And hope that people will use good judgment. But if you don't have any potential, if you have somebody that was exposing the public despite the warnings and continued it, you have to have some ability to have a sanction for that conduct. I can tell you the sheriff wants people just to do the right thing. His people are going to still patrol just like they normally patrol. We hope life and citizens will take matters into their own hands as far as public health and safety and their own safety, and just try to stay home when you can. I mean, if you can telecommute. If you have to have people to office, reduce the space, reduce the number of people, maybe have them come in at shifts. We want you to continue your business, but at the same time, the world is a little different today than it was, previously.
Gotcha. And last, Ken, I had a couple of questions as some of the other commissioners. When it comes to this particular ordinance, depending upon where it ends up, explain the difference between essential and non-essential. And I want to put it from that perspective of the West Georgia Board of Realtors, who had a couple of questions to include builders and so on. How and where those types of entities fit within this particular ordinance and or essential or non-essential?
Yeah, well, and I want to be careful about a tick for tack, but let me give you an example.
Okay.
So a contractor is probably, unless they're working for GEMA, FEMA, or working under federal authority, a contractor supplying metal or materials to FEMA or GEMA or the military for purposes of providing logistical support for the COVID-19 response, they're probably essential. A real estate agent that's simply showing houses is probably not essential, but it doesn't mean they can't function. During the hours of 6 a.m. to 9 p.m., they can still function. Now, what would we suggest? And I'm putting on sort of a quasi hat of a legal versus a medical, and that is, does it really make sense to be wandering in and out of houses if you're sick? No. Does it make sense to check and make sure the occupants of the house are either not there or not sick? Yes. Should you, like if you're getting an appraiser that's going in a house to do a refi, because there's a lot of that going on due to interest rates, the appraiser, first you need to find out if you're a consumer, Is the appraiser well that's coming to your house? Do they have a fever? Do they have any symptoms, number one? Can you isolate your family away from where they're going to be? Can you open doors in advance so they're not touching anything? Should they wear a mask and should they wear gloves? Probably. And you should do things like that. And so I guess, Commissioner, they're not getting shut down by virtue of this adoption if it's adopted, but they're being strongly encouraged to please be practical, to please use common sense, to please use their best efforts. And in fact, the city's adoption of this yesterday and working with us and their legal department was simply to clarify that business can be conducted, but it probably needs to be conducted in a different way than we're used to.
Okay, thank you. And Ken, I do have another question, not for you though, Ken. So I think I'm gonna hold my last question more of a, I don't know if it would be to the Dr. Mimar, or would it be to this board as to what's the time frame of this particular ordinance? Is it one that we're, it can't be indefinite, but I'm assuming that we've got a time frame on this particular ordinance. I know we've been rushly reading through a lot of stuff, but I would have to note that my concern is what's the time frame, at least where we're trying to get to, and then once we get there, it stops, or come back and we revisit it as a board, because I can't see us just kind of making this indefinite, not knowing when it would be. How long is my question, so?
April 10th.
Oh, April 10th, okay,
Yes,
so I missed
April
that
10th,
date.
Commissioner.
Okay, so this, no, that's not for you, Ken. So April 10th is kind of the next revisiting of this, depending upon where we are.
April 10th, it says unless extended, modified, or repealed by executive action. Yes, so we'll revisit after April 10th.
So that would be from you then, I guess. It won't come back to the board for a revisit, if I'm hearing you correctly.
According to, yes. But I would love for it to come back before the board.
And I was gonna say that I would strongly recommend that beyond April 10th, or when we get close to that date, that it doesn't take an executive order. I would like for us to be on the same page as to whatever this is, that we decide to extend it, or which, from my reading, it's gonna be a lot longer than April 10th. I'm just kind of giving you what I'm getting from a national perspective. But with that being stated, I would just hope that it wouldn't be an executive decision versus a board decision.
Right.
So that's what I will highly recommend. After that, I'll yield.
Thank you, Commissioner. Definitely wanted to be a board decision. This certainly is a big decision.
Yes.
And it's affecting more than just me. And I want to make sure that I have a unified approach and echo response from our board. So definitely, that's the reason why we are here today. I wanted the board to be with me and stand with me on this issue. Okay. Any other questions? Okay, Vice Chairman Robinson.
Yeah. A lot's being said here today. There's times to be silent, and there's a time to speak. And this is a time to speak that, for the citizens' sake, enough is not being done. I'm listening to the narrative that was put out, and it did not represent my position on how we, as it relates to the SBA for my small businesses. That's one option that's being given as hope. You got to qualify for that. So I'm being asked to make a decision that will all but slow down the small guys. Now, what is the impact on that? I know how many small businesses are in my county. I know how many are in my district. I know how many are 0 to 9 and 9 and above. And I get what we're doing, which is, okay, we're trying to save lives, but I'm also destroying livelihoods. It's both. It's not either or. It's not an emphasis on healthcare alone without, there's an impact. And I'm looking at this and I'm like, yeah, but I'm destroying my neighbors' lives with this decision. This is something that could have been done at the state level, but yet they've pushed it down. Y'all make the call. Y'all figure this out. I'm listening to what the public health says, well, we need resources. I get that, but we'll go get the battleship. Go get what's necessary. I'm making an appeal to my delegation. Like it's, where are y'all at? I'm making a direct appeal to Representative Roger Bruce, Senator Donzella James, Senator Dugan, Majority Leader, Minority Whip William Bodie, Sharon Beasley Teagues, Jay Collins, Micah Gravely. Where are y'all at? Where are y'all at? Help us down here. Help our citizens. If you need capacity over there, then make it happen. If we're saying you got a hotel, I know when we came up with a solution, here's a hotel. Convert it. Get the money that's necessary to convert it or expand the hospital. What I'm not hearing is what is the expansion plan? You're pushing it down on the citizens. I'm like, okay, they're gonna pay for this. We can't spend money on the backside of this. My sales tax is getting softer. And I get lives matter. And we're just out here nebulously. I'm like, okay, I'm waiting for somebody to say something. Y'all are not addressing the issue. We're pushing the can out. Now I got Dr. Memark. I got you. But I'm looking at the people like, well, address the issue with the capacity. Like, what are you doing? Well, go get the test kits. Don't keep telling me, well, y'all hang in there. Here's an option for you to go do this. But I'm making a decision, but all but destroys livelihoods that you're not going to recover from. Like, the governor's not doing it because he doesn't get to own it. We own it if we do this at the local level. Public health, we can just sit back and let y'all do this and you block, but y'all are asking me to stand there for the citizen state. And with me doing this, it's like, oh God. Oh God. This is tough, guys. We don't know when this is going to come out. And I get what we need to do, but I don't see the help that's necessary to address. You're not addressing the issue, which is the capacity. We're sitting here like, well, what do I need to do? Cut my operating budget by 10% to make sure y'all get what y'all need? I'm willing to do that. I'm willing to make that a condition of my vote today regardless, but I'm looking at this like, okay, well, what's necessary? You're making it at the local level. I heard our mayor on a call. I heard her heart like, oh my God, the vision that we have for our cities and our county. Oh my God, look where we're at. We got to make this decision, and it's going to have an impact, and it's not going to be recovery fast, but I don't see the capacity being addressed. I have a problem with that. Dr. Memark, I get it. We're buying you time. But in buying you time, my local economy is being impacted, but yet I don't see a plan coming for how they're addressing your side of the equation. We don't own it. If we owned it, I'd be in a different place. We'd be making a much different set of decisions. What you're asking us for is to come alongside of you and like, okay, message to the people. You're saying that a curfew would be, you'd like to see it, but we really don't want to go that hard. Not yet. Is that accurate? Dr. Memark, answer that question. Do we need a curfew solidly, or is this, I heard you earlier, but for one more time, because we're going to get, I think Madam Chair is ready to move. So what do you think?
I don't think the curfew is the most important thing here. It's trying to get people to stay at home as much as we can. So, if you feel, are people out the most after 9 o'clock? I don't think that's really the case. But if that's the case, then curfew needs to be put in place, if that's the case. But I think whatever we need to do, we need to try to keep people at home. And the capacity issue that you're mentioning, that's Plan B, okay? Because we didn't do what we needed to do. So if we go to Plan B, there's no guarantee that anybody's going to have that capacity. New York right now is begging for ventilators right now.
Okay.
So if we all wait for Plan B, there is no Plan B. That means, to me, as a physician, when we say we wait for capacity, why aren't you building capacity? Well, then we're asking for people to die. Okay, because we're saying we're not going to stop it with what we have to stop it. So we're just going to start building hospitals, and we're going to allow the death rate to go up.
Good point. But it's sometimes it's a false argument. It's not either or. It's both.
Yes, and I told you they are preparing for that.
Right.
Okay,
right.
so it's not me personally, but we do have teams that are preparing for
Yeah,
that.
so, but it's really both, like, I get it, you run in parallel, like, no, we're gonna do our part to slow this down. To Madam Guide's point, we were unprepared. I won't get into the whole healthcare, I'm not gonna get into the nationalism conversation that our attorney tried to float out there, and, in the midst of all this, but, okay, I do get it, I do get it, but it's both. But it still has a very real impact. And again, I know what you're asking for. And so it's localized. And so we're asking for the cooperation of citizens, and that's really what this is appealed for. This is voluntary, right? Not a mandate. Is that accurate?
It is voluntary, but, if they're, like the attorney said, if there are people who willfully endanger other people's lives, I actually do have the authority to do something like that, to do something about that, but so do you all. But we hope that nobody is going to do that. But every now and then it does happen.
Yeah, but it's about the enforceability. We won't go into that.
No, but, I think most people are going to listen.
Yeah.
Most people are reasonable, but every now and then you get some people that don't want to.
Well, I mean, we got the young youth that's walking through the mall or walking around, they're coughing out loud, I got COVID. I mean, you do have bad behavior. But 90% of the people do behave. 90% of the people do behave. I mean, if you think about the felons that are in our jail, it's 2% of our population. So we spend all that money for 2%. Most people behave. I get it. So, all right, so in conclusion, you're asking for some support from just really the public. You don't need any money. You don't need anything other than it's going to cost us to be able to do this because we're touching it and impacting our local economy. We've selectively, I mean, I get people can, we're saying that they can work, but they really can't. You still have people who are not coming to work. You have somewhat of a fear out there because we don't have any data, and Douglas was my point, to really give them any confidence in a more normative sense. It's like, okay, we're trusting, I get the qualitative, but it's like, it's not either or, it's both. Because it's what the citizens are asking. We can't dismiss what they're feeling. We can't deal them their view. We can't treat citizens like that. We have to respect the fact that, okay, but why can't you tell me? Right? Why can't you answer that equation? Now, it's not yours to answer. So I'm real sensitive when citizens express how they feel. There is anxiety out there. There is, like, my son may be concerned that he's never experienced this before. So sometimes as an elected official, you can't deal people their voices. You can't make them feel as though like it doesn't matter. You need to see life this way versus that way. There's been a lot of expression from the citizens about just really, what is our plan, right? Our economy is softer now because of it. I don't want to make this a budgetary conversation because it's really not, but it will cost. And it'll cost in the near term. And I'm prayerful that there's wisdom here, that we're going to have to do what we have to do to make this, make us all get through this. I yield the floor, Madam Chair.
All right, thank you. I'll call the question. Board of Commissioners, we have tab number 1, which is a business item today, is approval of an emergency ordinance related to COVID-19 as it relates to a shelter in place. Let me just reiterate the purpose of this ordinance. The emergency ordinance recognizes the serious public health emergency, which is also recognized by the Douglas County Board of Health and various other agencies of the state and federal government. The emergency order is intended to have a duration through April 10th unless extended, modified, or repealed by, and Ken, I would like to say by the Board of Commissioners, not by executive action on this particular ordinance.
Thank you.
All businesses, Clerk, do you have that? The emergency ordinance. Yes.
You can issue an emergency order to modify normal ordinances like creation of this emergency ordinance. The baseline ordinance procedure for adopting a modification of baseline ordinance is much different. It can stay as it's written, but you can commit to your fellow board members if you choose to that you're going to bring them back in session to extend it if you'd like. But in other words, we're not modifying another emergency order statute because that would require publication, et cetera. What you're simply doing is adopting this. If you want to scratch it, that's up to you, but I think you can decide you're going to commit to the board. I think you probably need it in place just in case there's an emergency that does not allow everybody to come together.
Right.
Because that is a power that's already there, but subject to your communicating with board members, whatever means is necessary. So I'd recommend just leaving it like it is, but you can say to them that you are going to involve them, and you're going to call a special call meeting if need be. But if there's an emergency that doesn't allow that for whatever reason between now and April 10th, that's why it needs to be, I would suggest, stay like it is.
Okay, thank you. We'll leave it as is, but board, for this particular, if this actual ordinance change, I will call a special call meeting. I'm going to move on to the next. It says the emergency ordinance strongly encourages public health best practices, social distancing, and limiting public gatherings. All businesses are allowed to function subject to public health best practices, including social distancing, limitations on gatherings. Non-essential businesses can operate during the hours of 6 a.m. until 9 p.m. Non-essential businesses are allowed to restock and handle logistics post-hours. The public is allowed to travel to non-essential businesses from 6 a.m. until 9 p.m., subject to public health best practices. And tab D, essential businesses are exempt from any time requirements but are encouraged to use best practices, social distancing, limiting public gatherings, and etc. People are allowed to travel for any essential purposes, such as healthcare, pharmaceuticals, and medical supplies. In continuation of the chairman executive order, gatherings are limited to 10 people using social distancing best practices except for household families. Board of Commissioners, do we have a motion to approve this emergency ordinance?
So move.
Second.
We have a motion and a second. I'll ask quickly any discussion before we go forward. Vice Chairman Robinson.
Absolutely. Keep it real tight. With my vote, I ask for the following, and so I make this motion. A 10% cut in operating costs across the board. Second, an appropriation of $1 million out of our fund balance, up to $1 million. Pay attention, Lisa Wasta, up to $1 million out of the fund balance for emergency as an appropriation to deal with anything regarding this public health, to leverage our dollars with our state if need be. Finally, for our seniors, an appropriation of up to $250,000 to deal with the net balance of seniors who are not being addressed by this. I recognize our senior center, but recognizing the net difference between that and the total population. That is my motion. I yield.
Any discussion from any other board members?
It's a motion within your motion.
That is considered an amendment. It would require a second and discussion, and then it would be voted on first before the main motion that's already before you is on the table.
Yeah, okay.
All right. So I made the motion.
Do we have any seconds?
I think my motion is on the table, is it not?
The amendment's first, right, Ken?
Yeah, the amendment
accept it
requires
as
a
it
second
is.
to be considered, otherwise it dies.
I have a second. We had a second.
She has a second.
Just one comment. I think that we can address that, what Commissioner Robinson's talking about when we get together and talk about what we need to do. I don't think this is the place for that amendment. But I leave my motion on the table as is for the adoption of this ordinance.
Point of order, Madam Chair.
Okay.
I thought Ms. Guider seconded the motion of Kelly, correct?
No,
She did not. Oh, my apologies. Okay.
Commissioner Carthen seconded my motion, right?
Oh, the existing motion.
Okay, sounds like
Point of order. This is simple. we're within a motion. You can amend within a motion. We've had this before. So what's on the floor right now is that, will anybody second for discussion, the amendment that I put forth as far as the 10%, the 1 million, and the 250? Because that's what was on the table, and it is relevant.
Madam Chair?
Yes, Ken.
I'm
Attorney.
sorry, I missed. Commissioner Robinson made an amendment that is on the floor first before the main motion to be considered, provided it got a second. Did it receive a second?
That's what we're getting point of order to know what we're
Yeah,
doing.
we're trying to get a point of order. He made a motion to amend, but he has not received a second yet.
Have to call for it.
Okay.
You need to, Madam Chair, if there's no second, there's no discussion of it. If there is a second, there's a discussion, then a vote on the proposed amendment first, and then a vote on the main amendment that was made regarding what's before the board.
So just call for a second.
Okay? Do we have a second for this amendment?
Well, we had a second for the,
Yeah, he just wants to focus on this one now, Commissioner Guider.
To make it clear so everybody knows, we're not talking about a second on the main motion.
Right, we
We're talking about
understand.
this Commissioner
Yeah,
Robinson
we understand.
doesn't have a second.
Okay, we have it. We understand. I'll try once again. Do we have a second? If well, for lack of a second, the motion fails. All right, can we go back to our original? Okay, we have
Yeah,
a,
now you take the vote on the main motion,
okay.
after discussion, if any.
We have a motion and a second. Any other discussion? We have a motion and a second. Please indicate if you're indicate by raising your right hand if you're in favor.
Madam Chair.
this is on
I
the
think you probably
initial.
wanna- Oh, I guess we can. I was just thinking that we want
It's
to,
on
for
this,
the,
right?
that was going to be
Yeah,
verbal.
on the first one. I reverted back to the first original
Yes.
motion and
discuss
second. We had a
that
second on the
other
floor. I
later.
ask any discussion. We don't have any more discussion. We have a motion and a second. Please indicate by raising your right hand if you're in favor of this. We have a,
Well, Commissioner Carthen seconded the motion, so.
Yeah.
we
yeah.
have a
She not
3.
Voted for it.
We have a 3, 2.
No, no,
Oh,
no.
I'm sorry,
No,
3.
yes.
We have a 4. 4. Your hand up, Commissioner Guider?
Yes.
Okay, we
Okay.
have a 4-1 vote, and the motion carries.
Okay. I can't see.
Madam Chair, on that point, I would ask that Mark make sure that the actual ordinance gets signed off by the commissioners before they leave.
Yes, sir.
Just a signature
Look,
line for
yeah, we're
everybody.
taking care of that.
Okay, thank you.
Okay, and we have one opposed. All right, if there's nothing else to come before this Board of Commissioners meeting, thank you all so much. If there's nothing else to come before, you have
Madam
anything,
Chair,
Commissioner?
I
Guider?
do.
I mean, I'm sorry, Commissioner Carthen.
That's okay. You just forget me all this
I'm
week.
all about clipping. Go on, there you go.
Yeah.
So I do want to acknowledge the point that my colleague Dick made. This will have an impact on our small businesses, but we know life and livelihood are connected. So we just want to express to the citizens and to our colleagues up here, we will count the cost of this.
Yes.
We know it will cost us. We do hear the cries of our small businesses. We do understand the impact. And as your government, we will do all we can to help. So I would implore my colleagues that are sitting up here, when we get together on our next meeting session, to please look at what that impact will cost us, to adjust accordingly, and to really be impactful and intentional about what we do moving forward. With that, Madam Chair, I yield.
Okay, thank you. And also, I want to just close by saying thank you to the citizens of Douglas County for joining us today. I know we have some citizens joining us by Facebook Live, and also to Dr. Mimar and to Lisa Crossman for being here, and our entire staff. Mark Teal and Ken, you're available by phone. And just wanted to say that I appreciate the tremendous support and concurrence from this Board of Commissioners, allowing and giving me authority to make decisions that are certainly very difficult at this time. Certainly under these unprecedented times, I had to just work through a process. This is a heavy burden for me, but I was taught very early I have to separate my emotions from my responsibility of protecting lives, and that's just key and also to make sure that I look at our business as well. I just believe that there's an ability to exist and there's a balance out there. I wanted to leave a note for our citizens. I just wanted to say that, again, we will get through this. I call it a tide. They roll, and then sometimes they roll in and they roll out. But I know at the end of the day, we still will be standing unified here in Douglas County as one Douglas. And I want to leave you citizens with this note. Whenever you find yourself doubting how far you can go, just remember how far you have come. Remember everything you have faced, all the battles you have won, and all the fears that you have overcome. And we will get through this. Thank you so much. Board of Commissioners, well, Commissioner Robinson?
No, real quick, and again, we're just all acknowledging, we're all on the same page as relates what's in the best interest of the county. But you don't want to be dishonest and be somewhat not all truthful about what this is going to take. And I just think that the burden on the local, it's real. And for us to, I mean, we're giving you words that are, yes, we care, we love you, and I'm like, but y'all know we about to, this is being impacted at the local level. And so how do I look my neighbors in the eye when we get to pick and choose winners? How do I look my neighbors in the eye knowing that, okay, well, yeah, this cost gonna be to pay, but I'm the guy that has to sit there and cast a vote on how we do that with no aid from anywhere. It matters. And so it's like with the relationship. Be honest with your spouses. It's like a relationship that you're in covenant with. Be honest. Don't deal me my voice in that, like, yeah, it's gonna be okay. Don't do that. We're going to feel this. Yes, we're going to get through it, but this, I mean, it's material. And I will respect my peers. We'll hold off on this, but we're going to come back to this. Mm-hmm. And so I yield with that. Thank you, Madam Chair.
All right, thank you. Well, if there's nothing else to come before this board, this meeting is adjourned. Thank you so much.